Good afternoon, everybody. I'm sorry we have to be back here this afternoon doing yet another hurricane press conference, but I continue to appreciate the work that you all do to help get the word out to people across the state of Louisiana so that they can be better prepared themselves and their families and in the best possible position once these storms make landfall. Zeta is expected to make landfall as a Category 1 hurricane on Wednesday evening in southeast Louisiana. At this time, the hurricane is expected to be primarily a wind event. Obviously, there will be higher storm surge and water levels than normal along the coast, and there will be some significant rain, but right now it's 2 to 4 inches of rain expected across southeast Louisiana. Locally, it could be heavier in certain areas, but the biggest threat as of right now, based on the hurricane forecast, is damage from the wind. As we know, especially from this year, hurricane tracks can shift and forecasts can change. However, we are just now a little more than 48 hours away from the forecasted landfall. And so we all need to be weather aware. We need to pay particular attention to the forecast, not just to the track, but to the intensity as well, and what the impacts will be that we can expect. One thing we are fairly certain of right now, and that is that Hurricane Zeta, it's Tropical Storm Zeta now, but it'll be Hurricane Zeta soon, will make impact landfall in southeast Louisiana. So earlier today, I issued an emergency declaration ahead of Zeta. And between COVID-19 and severe weather, I think that was the 8th state of emergency this year alone. An emergency declaration is obviously an essential part of our game plan to preparing for and responding to any emergency, natural disaster or otherwise. It goes without saying, I think, that we can't control where this storm is going to go, what its strength is going to be, and so forth. The good thing and the bad thing at the same time is we've had a lot of practice this year. Southeast Louisiana has largely been spared, while southwest Louisiana has been hit by 2 devastating storms. And so I'll tell you, I'm relieved that as of right now, at least, the storm is not tracking towards southwest Louisiana. We don't think that that's likely at all. And I will tell you that much of the preparations that we've done in southeast Louisiana in advance of other storms remains in place. And so that should be helpful. We have had southeast task force calls each of the last 2 days, and I know all of our parishes are working. FEMA is fully embedded with us at GOSEP, so we're doing everything that we can to prepare for this storm. The National Guard, which I will have to say again, has just done a tremendous job every time we've ever called upon them, but particularly in 2020, have more than 1,150 guardsmen activated. They have a variety of high water vehicles and boats and helicopters pre-positioned for search and rescue efforts. They also have food and water pre-staged for post-storm distribution should that be necessary. On top of preparing for Zeta, the National Guard continues to respond to recovery efforts in southwest Louisiana related to Hurricanes Laura and Delta, and they continue to work very hard on our COVID-19 response as well. CPRA is monitoring 689 gates across the coastal zone, both along the river and in coastal areas of the state. As of my call earlier today, 181 gates have already been closed. As we brace for Zeta, there's still more important deadlines showing up for those who've been impacted by Laura and Delta. Survivors of Hurricane Laura have only 1 day left to register for FEMA assistance. The last day to register is October 27th. The disaster unemployment assistance deadline is also approaching. Eligible individuals impacted by Hurricane Laura have until October 30th to apply. Disaster unemployment assistance for Hurricane Delta has opened for residents of Acadia, Calcasieu, Cameron, Jefferson Davis, and Vermilion parishes. The deadline for Hurricane Delta is November the 19th. We continue to have individuals in shelters in Louisiana from Hurricanes Laura and Delta, a total of 3,587 of them. 3,447 were Hurricane Laura evacuees and 140 Hurricane Delta evacuees. Of that number, just 41 total are in congregant shelter there in Alexandria, which basically functions as a reception center, so people can check in there and then be moved to a non-congregant shelter, a hotel. Because of the weather threat from Hurricane Zeta, community-based testing for COVID-19 in regions 1, 2, 3, 4, and 9 will operate as scheduled today, but they will be closed on Tuesday and Wednesday. We do hope to have these testing centers back open on Thursday. I can tell you that all state offices will be open tomorrow, and then tomorrow we will have an announcement about what can be expected on Wednesday. On the topic of COVID, today we are reporting 222 new cases on 5,059 tests. That is a very small number of tests if you keep track of the average number of tests that we report every day, but that's because we're coming out of a weekend. Not only is it a small number of tests, that's obviously a small number of new cases as well. The percentage of positive cases, however, is about the same as we've been experiencing over the last few weeks. Sadly, we are also reporting 17 new deaths for a total of 5,648 in Louisiana. Hospitalizations have increased slightly again today. We have 609 individuals across the state of Louisiana hospitalized with COVID-19. Ventilator use is also up a bit today, about 5, with a total of 71 patients on ventilators. So obviously we are still very much in the midst of a public health emergency, whether members of the House of Representatives or the Attorney General wish to acknowledge it or not. As we speak, I can tell you that we're filing a lawsuit in state court defending the COVID-19 public health emergency proclamation that remains in place through November the 6th, the one that I previously issued. And so I will say what I said on Friday. That proclamation remains in effect. The state is in phase 3 with all of the restrictions and mitigation measures that are prescribed in that proclamation. I will say it again also that the petition signed by members of the House, which would seek to end the public health emergency here in Louisiana, we'd be the only state without a public health emergency. And in light of the fact that the federal government has a public health emergency in place that includes Louisiana. But that petition is reckless, it's dangerous, it's irresponsible, and I'll also say it is unconstitutional. Simply put, the Louisiana Constitution doesn't allow for one chamber of the legislature to overturn a public health emergency declaration issued by the governor. Not only that, but the statute they rely upon requires prior consultation with public health experts from the Louisiana Department of Health. That did not happen. What's more, many of the people who put their names on that petition know both that the petition is a bad idea and also that it's unconstitutional. And I know that because they told me. And I know the Attorney General got a lot of attention this weekend for, I guess I'll be a little bit more charitable than saying he lied to you, but he certainly changed his mind from a September Attorney General's opinion that was put out by his office. But over the weekend, he was saying that the petition itself once it secured more than 53 members in the House signatures, that it overrode my order and that the proclamation was no longer in place. Well, that's not what the statute says, and he should check his own opinions, and he would have known better than to say what he said this weekend. And that's why I told you Friday and again today that that proclamation remains in place. So you'll see the relevant portion of the September Attorney General's opinion on the screen now. It clearly says that petition action alone isn't enough to overturn my public health emergency. What that statute contemplates is that if there's enough signatures on the petition, that I would then issue a proclamation ending the previous proclamation that created the public health emergency. So I guess he now disagrees with himself. I'm not sure. I will tell you that this entire deal with the petition is not something I wanted. Going to court today is not something I wanted either, but we have to be focused and resolute on managing the public health emergency while also recovering from 2 hurricanes and preparing for another. But as I said on Friday, I'm going to do everything I can as governor to discharge my authority and the obligation that I have to keep our people healthy and safe. The fact of the matter is we are in a public health emergency. Just Friday, the United States recorded more new COVID cases than on any day since the federal public health emergency started. I think it was something around 83,000. Utah is in the process of determining whether it's going to have to ration health care because hospitals are so overwhelmed. And in Texas, our neighboring state, there are no ICU beds or other hospital beds, for that matter, available in many areas. We know that there's similar situations going on in many, many states, including the state of Wisconsin. Right next door in Mississippi, we know that there's a shortage of necessary critical hospital capacity in certain parts of that state, which is why the governor today expanded the mask mandate to include more new counties than he did last week. So it is very clear that the anticipated and predicted second wave or third surge, whatever you want to call it, has begun around the country. There's absolutely no reason to believe it's not coming to Louisiana, although we remain in a relatively good place because of the mitigation measures that we have put in place and the restrictions that have been imposed by the proclamations that created and then maintained the public health emergency here in Louisiana. Again, I know that everybody's tired of COVID. We're also tired of hurricanes. But neither the virus nor Mother Nature is going to take that into account. We have to be resolute, and we need leaders to lead. As Louisianans, we always persevere. I think the reason that we are as resilient as we are is because we prepare for the worst and we pray for the best. So I'm asking you for what I pray is the last time this season. Visit getagameplan.org to make sure that you are prepared for the threat of severe weather. Understand that preparation this year is unlike previous years because of the COVID-19 public health emergency. Please monitor 511la.org for road closures. Pay very close attention to the Weather Channel, to your local weather sources, and heed the instructions of your local officials. And as always, continue to wear your masks, socially distance when you're in the vicinity of those who are not from your immediate household. Wash your hands, stay home when you are sick, and protect those who are most vulnerable. Finally, before I take questions, I want to remind everyone that tomorrow is the last day of early voting in Louisiana. ahead of the November 3rd election. So I encourage anyone, if you haven't already done so, take advantage of early voting. And again, tomorrow is the last day to do that. So with that, I will take some questions. Sam.
Governor, the law that you cited, it says thereupon, after getting the petition, the governor shall issue an executive order of proclamation ending the state of public health or emergency. You obviously haven't done that. Do you agree that you're violating the law right now because you don't want to nullify this?
No, you cannot violate a law that is unconstitutional by definition. Secondly, there are other statutes that tell me I cannot end the public health emergency until I believe that the threat to the public health is in fact behind us. No rational person believes that. Yes, ma'am.
In terms of the filing that you're doing, has it already been filed, and what is the actual legal filing that you are making?
It's a petition for declaratory judgment and injunctive relief. I can't tell you if it's been filed. It'll be filed today. I think it has been filed. Yes, here at the 19th Judicial District Court. Yes, sir.
You reached out to legislative leaders, specifically Clay Scheck-Snyder, since this petition happened, and do you plan to do that to discuss what he says this is aimed at is getting you to come to the table and compromise on some of these restrictions? Do you plan on talking with him about this?
Well, sure, we'll talk about it. The last time I spoke to him was Friday about this entire matter. I didn't call him this afternoon, but I'm always happy to talk to him. What I'm not able to do, and nobody should ever try to do, is manage a public health emergency by committee. You just can't do it. But we have shared the data that we've been relying upon with legislature and legislative leadership from the very beginning. And we have included them in sessions when we talk about the public health imperative, the decision making that I am going through, and I have accepted and considered input that's come from legislative leadership, including the Speaker. And I've done that on multiple times. And there's nobody who knows that better than the Speaker himself. And we will continue to do that, and I would expect that I'll be talking to him again very soon about this. Yes, sir.
Just to be clear on the declaration, if it would be vacated, what would happen to the federal resources going into the state?
Well, first of all, I want to be clear that it has not been vacated. The proclamation that I most recently issued that carries the public health emergency for the state of Louisiana through November the 6th remains in full force and effect. We are in phase 3. The restrictions that were set forth in that document remain in place, and so forth. Obviously, and I went through a long list of things the other day on Friday about the adverse consequences of prematurely ending the public health emergency. Quite frankly, you put at risk federal funding that comes from the Stafford Act because the federal agency that is primarily responsible for managing this public health emergency is FEMA. It operates through the Stafford Act. The Stafford Act is there for emergencies and disasters. And if the state of Louisiana is saying, well, we don't have an emergency, then you put at risk funding, but you also put at risk the assistance that we're providing locals, whether it's local governments, hospitals, nursing homes, so forth. And just on requests that we have received from those entities, more than 9,500 requests from them have been met by the state, operating through GOSEP. And so you put all of that at risk, and we again would be the only state in the nation without a public health emergency were these misguided legislators to be successful. That's clearly not in the best interest of the state of Louisiana, and we remain number 3 in the country for per capita cases. Now we've been overtaken by North Dakota and South Dakota. Part of the reason is we've done better of late, but we surged in the March-April timeframe. We surged again in July. When we came down from that surge, we've been relatively flat, which is why other states are catching up with us. But as soon as you start having success, because of the way you're managing the emergency, that is not the right time to discard the tools that allowed you to have that success. And it's misguided thinking by some members of the House, quite frankly, many of whom don't really believe in what they're doing, or at least that's what they told me. Yes, sir.
If the state fire marshal's office walks into a business tonight that is violating the rules, and their owner says, well, my state lawmaker told me I could do this because he signed this petition, what happens, and do you guys extend any leeway or grace to those businesses because they're confused about what's in place?
Yeah, I will tell you that does obviously add to the difficulties of managing this public health emergency. I've been saying from the very beginning that this is not the sort of situation that you're going to enforce your way through. However, enforcement is critical. We have always bent over backwards to work with business owners who in good faith may make a mistake or whatever, and we just try to correct them. But I'm just going to say again, in answer to your question, what I said Friday and what I said earlier. As of right now, we remain in phase 3. The proclamation that I had previously issued is in full force and effect. All of the restrictions and mitigation measures contained in that document remain in effect. And so if we have legislators out there saying something different, they ought not to be doing that. And no business owner or any other individual should rely upon such a irresponsible representation from a member of the legislature or from the Attorney General either. Yes, ma'am.
So the arguments that are being made sound like they're twofold. One, that the entire statute is not constitutional on its face, and the other is that they didn't follow the public health, the requirements to talk to the public health agency ahead of the petition. Is that right?
Well, the statutory scheme that they relied upon requires that they consult with the Department of Health, Office of Public Health, before doing that. And of course, the word consult is used in the statute, and it's got to mean something. Well, they didn't do it. There's nobody at the Office of Public Health who believes that we're not currently in a public health emergency and that the emergency declaration need not remain in place. But there was not even any effort. It's a complete fiction to say that there was a consultation. And in fact, the petition was written before anything that could have constituted a consultation would have happened. I mean, so it's a fiction. They didn't do it. And that certainly, I believe, renders their action null and void. But the biggest problem they have is that the Constitution does not allow one body. The House of Representatives is not the legislature. The legislature is a co-equal and independent branch to the governors, but not the House. And even when you have a co-equal and independent branch, it has to operate, I think without exception at least, with a 2/3 majority from each body. A simple majority off by one house, that just doesn't cut the mustard. Yes, sir.
They may have met with the Office of Public Health, but you're arguing that that meeting doesn't constitute a consultation because the Office of Public Health didn't agree or consult that they should end the emergency. Is that what you're saying?
Well, I'm not sure that they met with the Office of Public Health either. What I'm saying is at no time did they engage in anything that would constitute a consultation, which is what's required in the statute. Another question or so. Yes, sir.
Have you made a decision on HB4 yet, whether or not you'll veto that?
I never do my own bill numbers. What is HB4?
It's the one by Mark Wright, the
Oh.
limitation on coronavirus.
Yeah, I would anticipate that I'll veto that shortly.
What about HB 51, which bars local election officials from taking private
I
grant
vetoed
money?
that today.
Vetoed that? Okay.
Yeah. We're gonna have a UCG meeting tomorrow at 30. We're going to have a press conference back here regarding Hurricane Zeta and our continued preparations for that. tomorrow afternoon, and we're looking at 3 p.m. Again tomorrow here for that press conference. And so again, thank you all for continuing to cover this. Thanks everyone at home, especially those in Southeast Louisiana, for the preparations that we're going to undertake in advance of Hurricane Zeta. Again, let's prepare for the worst, pray for the best. Let's be good neighbors to one another. And that certainly includes wearing a mask. So with that, we'll see you tomorrow.